Okay. Good afternoon, everybody. A lot of information today. We'll go through it all and then take some questions. I'm sure there's lots of them. Today's COVID data is a mixed bag. It's been a real tough day. We've lost 13 residents of the community. Caucasian female in her 90s, Caucasian female in her 80s, 2 Caucasian females in their 70s, 2 Caucasian males in their 80s, Caucasian male in his 70s, and then 6 residents of nursing homes. So obviously we're devastated for these families. We've lost 502 residents of this community since the beginning of the pandemic. And please keep them in the hospital. That's down 21. That's the lowest since December 6th. We had 39 folks discharged from the hospitals over the last day. That's important. 20 individuals are still pending transition to the COVID transitional unit at Loretto. I want to thank our partners at Loretto again for this. So essentially, we have 277 folks in Onondaga County in the hospital. That's a low for over a month. There's 20 out of the 277 that have recovered. They haven't tested negative yet for COVID. They'll go to Loretto for a period of time. When they test negative, they'll go back to their home. And so really we're talking about 257 right now. So capacity's gotten better. Overall capacity, when we look at the hospitals in Onondaga County plus everyone else we service, which is not just Central New York, but Northern New York and at times other parts of the state, down to 362. Again, that number's been in the 400s over the last few weeks. So that's the positive, I guess, today. ICU, 46 of our neighbors are in the ICU. Please keep them in your thoughts. Looking at cases, Thursdays and Fridays are our high days. Part of that is that's essentially when the flow of national labs come into the community. Our local labs turn times 24, 36, 48 hours. National labs, more 3 to 5 days. So like clockwork, we get dumped on Thursdays and Fridays. So 471 new cases. Daily rate is actually the best we've had in a while. I think it's 5.9. Lots of tests came back through. Again, when you look at our case flow this week, we'll see how we end out. Shot to be about on par as last week, maybe a little bit better. Certainly last week we had high case day. Our high case day today is less than it was last week. So that's just the trend. That's been the trend for about 5 or 6 weeks now. But the positive rate being in the high 5s is the best we've been in about 10 days, 12, 14 days here. Looking at who's been impacted, we now had 23,051 COVID positive cases since March 16th. We've had 12,318 females, 10,592 males. Under 19 and under, again, most of these numbers are your 17, 18, and 19-year-olds, but this is how we track it. 3,546, 20s, 4,604, 30s, 3,452, 40s, 2,843, 50s, 3,315, 60s, 2,485, 70s, 1,371, 80s, 909, and 90s, 526. Let's go through testing. Again, testing's key to all this. We do as much testing as we can. That's how we find asymptomatic carriers and how we end this. I know this is a roller coaster ride that we go through every day with this pandemic. Part of the reason we've been more stable than other communities our size, and the state overall has been more stable than other states, is because we do find it. So we'll get high numbers, but every time we find a case, it's actually a success, so that we can isolate it and we can stop that strain. So looking at testing, again, if you're symptomatic, please go to ongov.net/KUGAmedical, Monday through Friday, 9 to 2. Weekend symptomatic testing. So this weekend, if you come down with symptoms, go to the same website, but then you would then go get your test at Essentia Health. That is, again, ongov.net/KUGAmedical, 8 to noon, both Saturday and Sunday. We've done our asymptomatic testing. Judging by some of the numbers we've gotten this week, I think we have symptomatic people showing up at these sometimes. We try to want our symptomatic cases always to go with the PCR test. We think the negative test is more reliable when you do it that way. But COVID19.ongov.net is the website for registrations. Besides here at the On Center, we are at the Lafayette Community Center, Onondaga Town Hall today. Tomorrow we will be at Shove Park in the North Syracuse Community Center. Next Tuesday, and again, we fill in these as we look at gaps and we see capacity, we add testing sites. But next Tuesday, Syracuse Northeast Community Center right now. Wednesday, Fayetteville Senior Center. Thursday, Pompey Fire Department. Friday, Tully Town Hall. So go to ongov.net, register for a test as we go to the community sites. But again, if you are sick with symptoms, we prefer, and it's really in your best interest, that you go to the FSHED or the Syracuse Community Health Center or an Essential Health on the weekends or an urgent care so you get a PCR test. Let's talk about the vaccine. We're going to be very, very transparent with the vaccine and what Onondaga County is administering. Again, we're in week 4 of having access to the vaccine. Let me remind everyone that there was Operation Warp Speed, probably one of the greatest accomplishments from science in modern history, to get a vaccine, multiple vaccines in less than a year. There was manufacturing in advance of that, but not manufacturing for every resident in the country, let alone in the state. So supply is an issue. So this is going to take a little while until supply gets going. But let me go through the process. So the federal government will supply the vaccine to the state government. The state government then looks at the regions of the state, determines the phases of who goes in what phase. They make the determination, not the county governments. And then they've set up hubs. The Central Region Hub is upstate, one of our partners throughout this. From there, you will see vaccine being distributed either through the hub or to points of distribution within the region. So, Onondaga County, we set up our pod, point of distribution, at the War Memorial, and it was operational on Monday, the 28th of December. We received, from a redistribution from hospitals, 3,600 doses on the 28th and 29th. And how this works then is we then look at the phase, those who are eligible, and we have a registration form for those individuals. They set up appointments. Like everybody, there are people out there that will set up an appointment and they will not show up for an appointment. So let me go over each day what we have done and then I will tell you where the next vaccine is and what we're doing. And then I'm going to tell you what our capacity is moving forward. On Monday the 28th, we set up 145 appointments. We did 119 doses of the vaccine. On the 29th of Tuesday, we had 190 appointments. There was 180 doses of the vaccine administered. On Wednesday, 12/30, there was 311 appointments with 290 doses administered. On Thursday, the 31st, we had 512 appointments and 457 vaccines administered. On Monday, 1/4, we had 656 appointments with 608 vaccines administered. On Tuesday, at the end of the day, 1/5, we received an additional 3,600 doses of vaccine sent to us from the state of New York directly. We had 656 people pre-registered. We did 647 shots. On Wednesday, we have done, we had 752 appointments, Wednesday being yesterday, and we had 737 doses administered. We have a redistribution, which will happen in the next 48 hours with Upstate for 1,200 doses to be redistributed to us. So with the new vaccine capacity that we have, we now then will register for 4 days in advance. So today we have 1,260 appointments, and we will be able to report later how many showed up. Tomorrow we have 1,260 slots / appointments available. Monday we have 1,260 slots / appointments, as well as Tuesday 1,260 slots. We are now out of vaccine at that point. We anticipate another distribution from the state of New York. We have asked for more vaccine. Why is that? We have now built the capacity to do essentially 10,000 vaccine doses a week, essentially, in between 9 and 10 for next week. So we have asked for that. Whether we get that or not depends on the supply chain coming from the federal government to the state government. And then next week, I will tell you, we will go through all of this again, and I will tell you what our capacity is at our pod moving forward, but it will be more. So that is the distribution. Totally, we have had doses of vaccine, 8,200, appointments that we have either made and or have opened up to the community, 8,262. If we have a 100% Thursday through Tuesday capture rate, 8,200 doses, 8,078 vaccines will have been distributed. Obviously, we're going to continue to utilize all vaccine as soon as we can. Certainly, it will be easier and there will be much more demand as phases move on. Let me go over again Phase 1A, just so everybody understands who's eligible to go online, and then we're going to, I'm going to then give the 1A group the website that they can register on. Again, your high-risk hospital staff and psychiatric centers, your EMS personnel, medical examiners and coroners, funeral workers who have direct contact with infectious materials and fluids, agency staff and residents in congregate care living situations run by OPWDD, OMH, and OASIS. Urgent care providers all got their own doses for their staff, but certainly an urgent care professional qualifies as well. Staff administering the COVID-19 vaccine. When we look at week 4, where we are, all outpatient ambulatory frontline health risk healthcare providers, all frontline high-risk public health workers who have direct contact with patients, healthcare workers at testing sites. So any of these categories can come and register for a vaccine. What's the registration? covid19.ongov.net/vaccine/. If you're not in one of these groups, please don't register. We will check, we will verify, and if you're not, we will turn you away at the pod. We will get to every person in this county who wants a vaccine. You will get a vaccine. We will build up the capacity to do it as fast as any community and as quickly as we get the supply but we need people to work with the process. Again, when you come, this is similar to like a doctor's appointment. We have a system. If you have a 3 o'clock appointment, you can show up a little early, but don't show up an hour early. We don't have anywhere for you really to stand around. So 5 minutes before your appointment, that's what we suggest. But the good news is we've heard about upstate vaccinating and using their doses and getting their employees done. St. Joe's is doing it. Kraus is doing it. Our other regional partners are doing it. Our pod has been very busy. We'll be very busy next week, and we have built up capacity to be even busier. So if we get 6,000 doses from the state, we'll do it. We can do 10,000, though. We want to get 10,000. We'll see where capacity lands. Case investigations, again, our texting tool, I want to thank the public. You've been great. 55% of those who become COVID positive and are receiving our text message are actually completing their information and contact questionnaire online. This is just wonderful. Thank you for doing that. This helps us with staff. The more we utilize the tools we have, the more we can move people around, testing, vaccinating, in our 3 really pronged approach. So thank you for that. Again, the number that you'll probably see, 833-634-1564. Questions?
More vaccine once it runs out this week?
We're going to get more next week, Josh. What we are pushing for is to be able to utilize this infrastructure that's already built if our region's getting so much, utilize us. We already built it, and then utilize the other parts of it. We will be beefing up this infrastructure every week until it's clear that the vaccine, we got to wait for supply of the vaccine to catch up. So by mid-January, we'll be able to do quite a bit. And then by February 1st, we'll even be able to double that. Whether the supply chain by the manufacturers has caught up to that or not is out of my control. But what is in our control is that we have the pods ready to be very efficient and move very quickly because there's anxiety now in 1A. 1B, you open up large categories of people, including our most vulnerable and our seniors, huge numbers of people. There won't be enough vaccine available to do all that quickly. So we think the best point of distribution to control all of that, to know who's getting done quickly, instead of having 10, 15 different points of distribution, utilize this infrastructure first, and then we build the tentacles into the community from this.
Is that what you talked with the state about today? The governor just sent a lengthy email about a vaccine update. Did you talk to the governor's office today about? We did.
County executives from across the state spoke directly to the governor's senior team. I've had a great relationship with the senior team, specifically on this topic related to this. They've taken great feedback and concerns from us, whether it was the nursing homes need to get sped up with the vaccine. It looks like that's. I've heard one might not have been done yet. We're following up on that, but everyone else has received the first shot. Assisted living facilities, a week ago, we're hearing they aren't scheduled. I got an update from my adult long-term care department. Everyone has been scheduled, confirmed, except for one. We're going to follow up with that. Again, we've offered that if you send us the vaccine, we'll go do it ourselves. But they're in a federal program. The federal government is controlling the vaccine for those buildings. So. But the feedback's been good. We're talking to them. This is what county health departments and emergency management departments do. This is what we are trained to do. We have the infrastructure. Let's use it.
So there was a lag with assisted living facilities. I know some people might not know the difference between that and nursing homes.
Right.
Could you just talk about the problem that was going on in assisted living and
Yeah.
what's being done now?
So part of the federal program for long-term care, nursing homes, you're most vulnerable. phase one with the pharmacies. So Walgreens, CVS, phase one, get the nursing homes done. Phase two was assisted living facilities. We heard from a lot of folks. I hear from everybody, right? So we work with our seniors, our facilities throughout our community, with our adult and long-term care department. We have surveyed each facility, what's been done, how many have been done, when's your second shot scheduled, are you scheduled? Nursing homes look to be in good condition. There's one we heard might have been switched around. We're going to look into that. But a week ago, the assisted living facilities, many of them weren't even scheduled. So we started really pushing very hard on this. Now we go back yesterday, we survey the same folks. Almost every one of them scheduled, with the exception of one, and now we're pushing on that.
So, Ryan, you said in addition to the county, the hospitals are still administering vaccine. Are there other sites now that are also administering vaccine?
Yeah, I think outside the county, Tim. I think Madison County has put up a pod.
How about inside the county?
Yeah, inside the county, it's the hospitals and us. And quite frankly, there's not enough vaccine to have other sites until our pods can no longer meet the demand and getting the supply out quickly. There's probably no really other need for it. I know pharmacies will get in the game at some point, and then primary care providers at some point as well. And we think that's appropriate, but we got to do this in an organized way where when you're asking me a question like how many teachers have been vaccinated, I can give you an answer. And so, again, we'll have 2 very large pods built. Then, do we need our 3rd and 4th to be activated? We have plans for that. That depends on really how much supply we have of the vaccine. If we do need the 3rd and 4th to be activated, we have a 3rd and 4th location. Both pods you have, if you're doing X amount of vaccines at one site, you need a second one to do the same amount, because at some point you're doing second shots for everybody. So hospitals start working with their employees first with the Pfizer vaccine. The Pfizer vaccine has different requirements related to storage, so it makes sense for them to do first and second shots. We do our pod. Our pod really starts to address 1A for the community, and we think 1A will be in pretty good shape after next week, and then the state will assess and make the call. Do you do second shots in 1A before you do 1B or not? That will be the state's call, but we'll be ready to meet the demand at any point.
Do you know, are the hospitals still doing just their employees, or are they open to other people to sign up also?
I know they have done some others. I think right now most are being directed towards our infrastructure. If you think about it, going into a hospital for a shot, if you're not in that building, going up to the hill, it's just not people don't like doing it. And there's not, parking's tough, confusing, where do you park, all these different things. That's why our sites here, our second site, most likely Shoppingtown would most likely be the second site, and then 3rd and 4th site, we'll get to those when we need to. But great parking, very easy, people know where to go. It's just an easier way to do this.
Do those sites require like state health department sign off? Or
They do. They do.
And you're signed off on the second one at Shoppingtown, or?
Yeah, we'll, as soon as we get to the point where we know there's enough vaccine, we'll put that site in for final approval. We're not going to go open up 2 sites and do half the amount of people and pay for double the amount of people to work the sites until we maximize what we have on this campus.
Do you have the staff to ramp up like that?
Yep.
Who are they?
Well, you have so how it works is you have vaccinators, so you have people administering the shot. You have scribes who work with the vaccinators on all of the logistics, and then you have other employees that help with the logistics and communication getting through essentially the assembly line. And so, who are they? They're our county nurses. There are county employees in the health department and other departments. Eventually, we will be taking on vaccinators who are per diem nurses, retired nurses, volunteer nurses, doctors who have volunteered. In addition to that, EMTs can get trained on this. The training is easier said than done, but they can. Paramedics can get trained as well. So we have dedicated this is what's so important for everybody. This is where the focus needs to be for this country right now, is on this. And so that's why, we have put in our government, this is the most important thing we will probably ever do in my lifetime. And so nobody's going to be waiting on us. We're going to be waiting on the vaccine getting to us, and then right when it gets here, we're going to be shooting up people's arms.
Is what you're hearing, or maybe it's too soon to say, do you think we get to 1B in a week or so, or?
I don't know yet, Tim. I think the governor's really looking at it, because part of the challenge is you're looking at numbers of data based off of employees in these sectors. Not every employee is going to get a shot, right? And not every employee can get a shot at the same time. So it's tough to tell when you pivot to 1B, and then you're kind of dependent on the supply chain catching up, because as it catches up, it's going to be tough to start 1B and then stop, because you got to do the second shots for all 1A. But if your supply chain's starting to really pick up, where you can have a steady flow of 1B, get your second shots of 1A, get them done, then that's how you can do it. But I don't know if 1B starts, it will probably be very surgical, meaning if you have extra doses that day, if you open up a vial and there's extra 10 shots in the vial because it was opened, we're never going to waste it. We'll grab anybody off the street. We're never going to waste it. But they'll probably say you can take those, have a waiting list in 1B to go do that. I can see that happening, but I think we're waiting on the governor to make that call.
What happened with those doses? It looks like about 94% of the people have showed up to their appointments in the last 10
Those will
days.
carry over to the next day.
Do you think the people just got busy? Like, why weren't they showing
Yeah,
up?
or they weren't they weren't in 1A, right? And they figured it out. Sometimes you'll have people, maybe you schedule 2 different slots. You're gonna have, this always happens. This happens at testing sites every day too. So you get more appointments than you get people showing up.
Are you proud of that 94% number?
Oh yeah, I don't know. We've done almost 4,000 after today, 3,800. I don't think anyone else has done that as far as a county government, and it's very much dependent on the supply. Again, next week we'll do 10,000 if we have 10,000 shots, and the weeks aren't Monday through Sunday. The weeks are really Tuesday or Wednesday to Wednesday, because that's when the vaccine comes in.
I know it goes from federal procurement to the state to you. It's not literally following that path in supply, right? I mean, it's coming straight to Syracuse from the manufacturer?
We get mailed our vaccine from the State Department of Health.
It comes through the mail?
Or mailed, I don't know how it comes, through a truck? Through a truck, they drive it in, yeah.
Have you heard any more about the proposal to maybe have a countywide yellow zone instead of orange and yellow?
No, we've put it forward. I think if you look at our data, we're in zones in our county. Our data is better than many other counties that are not in any zones. I think you look at where we are, you look at the hits we're absorbing, and we're still not, things aren't falling apart. You look at where the cases are now, it doesn't bring any more risk by letting these other restaurants have 25% capacity at this point. So today's focus when we were talking to the state was on the vaccine. Certainly, I know there's been a lot of conversations going on from the mayor and myself. So hopefully we'll get some movement. Usually, a decision like that, usually you get one of those a week, maybe.
But they haven't set a target for us that if we get the positive rate
No.
down to 5% or something.
No, they have not. And again, everything, and I know I followed some reports about different things, and the data is relevant to what's happening at that moment in time, and so it's tough, and we're on a roller coaster every day, so we have to find balance. We were never going to have good data in the wintertime versus COVID. We never were. Even if you take out Thanksgiving, Halloween, Christmas, and New Year's, it was never going to be good. It was always going to be more than the summer. We've taken these bumps pretty good. We're essentially 2 weeks out from Christmas Eve, and we had an uptick and a small surge, but we haven't seen anything bigger than Thanksgiving yet, which is good. We were prepared for much worse, but we never, in finding your balance with this virus, we were never going to be under 100 cases during winter. We knew that. So now getting back to, after these, getting cases down again each week is progress. And if you look at what's happened to spread has been forced into areas you can't regulate. And at this point, when you find your balance overall, we can handle the caseloads. Our hospital numbers are going in the right direction. These businesses in these zones are being hurt. And at this point, we got to change that.
I know you want the focus to be on the vaccine program, but for these businesses that see the data kind of all over the place and counties that are worse than this, but they're being hit, what do you have to say to them?
We're working with you. They know that. The businesses know that. We've been on multiple calls. Each week I'm on calls with restaurants, the associations. We're looking at innovative ways to help them, and especially the ones in the orange zones, and get them out. And we're working at it. I mean, I've offered to put areas in my county that are not in a yellow zone to create equity, right? That might not be in my interest, but that's what's right. It's easier for us to regulate. Let's create equity. There's still regulations then, recognizing the severity of the issue that we deal with every day. But I think we're going to get some progress. I think we'll get some movement on this.
What do you have to say about what happened in Washington yesterday?
Obviously, it was surreal to kind of watch as it unfolded a little bit. We saw the reports. We're working on things like this. And then as it got more and more serious, it was just a devastating day for our country. The president lost the moral authority to lead the country, and the vice president was given a loyalty test, and the vice president passed his loyalty test, and I'm very proud of that. So, because he's loyal to his country, and so overall, it was a shocking, surreal day for those of us who've been in that building and been in those rooms and those chambers. It was just shocking, absolutely shocking, disgusting.
Since he's lost the moral authority to lead, do you think the president should be impeached?
I think Congress has a decision to make, and the vice president has a decision to make on that. There's no leadership out of the White House right now, and what's best for the transition. I think people should be very cautious with what's best when we have 2 weeks to go. Words matter. Words matter. And I think I'll give this political analysis very quickly. No party has a mandate in this country to lead right now. The Speaker of the House was a Democrat. She almost lost the House. The Republicans picked up many, many seats. The President of the United States lost the election, and he lost a very close election. The Republican Senate lost Senate seats, and then they had a special election where the Senate leaders' policies and decisions were under single focus, and he lost both those seats. The three leaders that were leading this country 90 days ago all got their butt kicked on election day. And so words matter from politicians on the right and left, and now's time for everybody to take a deep breath. We're going to get through this. The biggest challenge we'll all have in our career to face, hopefully, is this pandemic and getting through this pandemic. That's where everybody's focus needs to be. And the politics needs to slow down big time.
Circling back to the vaccine, just for a quick second, should we read into the fact at all that you got 3,600 a few days ago, if that's the same amount you'll be getting next week?
We need more next week.
More?
Yeah, I'm asking for more. I know what I'm going to get probably, but I need more. And they're working at it, right? Everybody's working together. If our region, if there isn't more vaccine to give, it's not the state of New York's fault. The manufacturer needs to manufacture more, right? But we have the infrastructure to do more next week than we did this week. And then the following week we'll be able to do even more. So we have the infrastructure here. I don't need to go hire nurses or vaccinators. I don't need to hire scribes. I don't need to rent space. We all have it. We have an assembly line process in the War Memorial that's working very well, and we're going to even grow that. This is we're ready to go. And this
What's that number in your mind? What's that number? What do you think you're going to get?
Where, as far as what on
Number of
January 18th, we will have the capacity to do 18,000 shots a week. Whether we have 18,000 shots a week of vaccine, I don't know. We'll see.
Thank you.